Branch, Dr. Albert Au, and from the Hospital Authority Chief Manager, Dr. Larry Lee. We'll first hear from Dr. Au. Good afternoon, everyone. Today I will report to you about the cases reported on the 1st of March yesterday. We have received reports of 55,353 cases, number from 238384 to 293736. In the 55,353 cases, there are 7,749 cases picked up by the Hospital Authority, 2,590 picked up by the Public Health Laboratory. The remaining 45,014 cases were picked up by private laboratories. Of the 55,000 cases plus, there are 27 imported cases, of which 23 were from CX796 from Indonesia, arriving on the 1st of March. Given the high number of confirmed cases on the same flight, under 599H, Prevention and Control of Disease Regulation, we have suspended this flight between the 3rd of March and the 16th of March. For the remaining 55,326 cases, they are local ones. In the 5th outbreak, we have altogether 128,199 cases. Yesterday, Public Health Laboratory has conducted genome sequencing for 2,199 cases. 6 of them are positive to L452R, which accounts for 0.27%. 1,876 cases are negative towards L452R. They are Omicron cases, accounting for 85.39 cases. The remaining 102 cases, the analysis is still pending, and there are 215 cases that are undetermined. In care homes, yesterday there are an additional 55 cases involved, 55 care homes involving outbreaks. 40 of them are as elderly care homes, and 15 of them are those for persons with disability. There are 716 cases, 488 of them are residents, and 228 of them are staff members. There are 18 on Hong Kong Island, 23 in Kowloon, and 1 in NT East and 13 in NT West. So altogether, there are 670 care homes with confirmed cases involving 3,650 residents and 1,150 staff members. That's all for my report. We'll now hear from Dr. Larry Lee. We have 6,400 patients staying in public hospitals, the community treatment facilities at Asia World Expo, the Infection Control Center of the North Lantau Hospital, and NHA's Infectious Disease Center. There are about 760 people staying at Penny's Bay Community Isolation Center. Yesterday, we've received reports of 64 patients in a critical condition. 55 of them have not been vaccinated. 88 cases are in a serious condition. 64 of them are unvaccinated. In the previous 24 hours, 117 people have died from COVID-19, 73 males and 44 females. An age range is 58 to 100. Of the people who passed away yesterday, 78 of them came from care homes, 95 unvaccinated, and only 6 of them received 2 doses, and 16 received 1 dose, and a high number of them are elderly people. There are 4 cases that are of a younger age. I'd like to elaborate a little bit on them. First is a 59-year-old female. She suffers from a renal disease, a chronic illness. At the Chin Shui Wai Hospital Renal Dialysis Center, her condition worsened. On the 28th of February, she was admitted. At 2:46 a.m. on the 1st of March, she passed away. The second one is a 61-year-old male suffering from renal disease, a chronically ill person. at home. He suffered from cramps as well, and he passed away. And he was admitted in the small hours on the 1st of March and passed away around the same time. There is another 60-year-old male, a cancer patient. On the 15th of February, he was admitted via the A&E of Princess Margaret Hospital. On the 1st of March, in the morning, he passed away. The last one, the fourth one, is a 58-year-old female who is chronically ill patient staying at the Kowloon Hospital long term. Her condition worsened after contracting COVID. She was sent to Queen Elizabeth Hospital. She passed away yesterday afternoon. Because of some time lag, I'd like to report that between the 26th and 28th February, there are 43 patients who have passed away. 31 males and 12 males of an age range of 58 to 99 years old. Upon verification, we found that there is an additional death case reported yesterday. For yesterday, the figure should be 116. Yesterday, we reported 117. The correct figure is 116. 116. Today is 117. So far in the fifth wave, there are 967 patients who have passed away. Most of them are elderly people. Over the past 2 years, 1,172 patients have died from public hospitals. There are 590 people who have been discharged and recovered. The current utilization rate of isolation bed is 87.5%. There are about 70 patients that were found to be confirmed cases upon the admission screening. So 155 patients are classified as close contacts. So far, 4,322 staff members have been confirmed. About 600 of them have returned to work. That's all for my report today. We will now take questions. Put your hand up, use the microphone we give you, and identify your organization. The gentleman at the back with the gray sweater. I'm from TVB. I'd like to first ask about the 55,000 confirmed cases. The increase is exponential. Well, is the rate of increase faster than before? Do you reckon, by how many the confirmed cases will increase? I'd like to ask about the Kowloon Hospital female patient who has passed away. What is her illness? How long has she been staying at Kowloon Hospital? Are there any other cases at the same hospital? Well, just now, the chief executive talked about treatment at home. Do you have a plan? What will be the approach? What medications will you give? And how do you do the diagnosis? And in relation to the use of Chinese medicine, how do you tell if someone is suitable for taking Chinese medicine? And is it too late to launch the treatment at home approach? I'd also like to ask about isolation facilities. But, the patient intake has started at the Tsingyi facility. In the future, for such facilities, will they be used for elderly people and children who can't really take care of themselves? We've heard that someone staying at an isolation hotel are not allowed to leave after their tests are negative. So is it the case that that caused a backlog when people should have been allowed to leave and they are not allowed to leave?
Yes, we recorded some 55,000 infected cases today, which is within our expectation. Recently, every 2 or 3 days, the number of confirmed cases would double. A few days ago, we had some 30,000 cases. Now we have over 55,000 cases. It is within our expectation, and it shows an upward trend. And we understand that more members of the public will be using the rapid antigen test in testing, finding out whether you test positive of COVID-19. Subsequently, once we have collected statistics in relation to testing positive via RAT, we will have a more accurate grasp of the situation. Once the platform is launched, we will receive reports from the public, and by then we will be able to, or we expect the number of confirmed cases to further increase. About treatment at home, Dr. Lee can elaborate on it. Basically, at this stage, for all confirmed cases, if possible, they will be arranged to stay in isolation facilities, including community isolation facilities, CIF. For those who have self-care ability, for those with special needs, they may be arranged to stay in public hospitals or HA facilities. Now, we understand that some citizens at the moment are waiting at home pending to be admitted into isolation facilities, and we do provide support. For example, we arrange for the relevant government departments to dispatch rapid test kits and anti-epidemic kits, including a thermometer, medication, and the relevant information pamphlets. And during isolation at home, if they begin to exhibit symptoms, or if they test positive via RAT, they should ring our hotline and inform our department and the Home Affairs Department. The HA also has a hotline to provide medical advice for these individuals. At this stage, the government is preparing to build more community isolation and treatment facilities for those in need, especially those who have just recently been infected because of the higher viral load they carry. Normally, if they do not have self-care ability, for example, for elderly patients and children, they will not be sent to community isolation facilities. The CIFs will be reserved for those with self-care ability. For those requiring care by another, they at this stage will stay at home or be admitted in the other treatment facilities. Be it a hotel or an isolation facility, we would arrange for another RAT test the 6th or the 7th day of their testing positive. Once they have 2 negative RAT results, they will be allowed to leave if they have been vaccinated. If not, on the 7th day, they will need to go through another test on the 7th day, and that if the result is negative, they can go out. Otherwise, they should stay home for isolation. For the Kowloon Hospital patient who was 58-year-old, she had a mental illness, and when her condition deteriorated, she was transferred to the Queen Elizabeth Hospital, and she succumbed to the disease after her condition got worse in the afternoon. For treatment facilities, be it the Hong Kong Infection Control Center at the North Lantau Hospital or the Asia World Expo Community Treatment Facility, they are reserved for elderly patients requiring a high level of care. We also receive children patients requiring care by their family members. As for Penny's Bay, at the initial stage, because of the influx of patients, we couldn't provide the support they needed in the initial stage, but we have continued to strengthen our support and enhanced our hotline service. We ask for the patient's understanding. Next question. This lady at the back. Good afternoon. I'm Hong Kong 01. My question is about Ching Yi Cabin Hospital. How many patients have been received? Another question. According to reports, there is a communal toilet to be shared by 20. And diarrhea is one of the symptoms exhibited by confirmed patients. Is this racial suitable. And according to experts, communal showers or communal toilets would not cause cross-infection. Can you explain why? Let's say if a patient is infected with Omicron and another patient with Delta, what should happen? Another question. Of the imported cases, 23 of them took 6796 arriving in Hong Kong from Indonesia. Are these 23 passengers all foreign domestic helpers? Let me explain the community isolation facility in Qingyi, or treatment facility in Qingyi. I understand that intake started yesterday, but I'm not sure about the exact number. The HA is responsible for the operation of the treatment facility, whereas other facilities will be operated by the government. About the 23 passengers arriving in Hong Kong via CX796, they arrived from Indonesia, and investigation is still underway. I would say that the majority of them are foreign domestic helpers. Next question, this bespectacled lady in the middle.
I'm from Bloomberg News. My first question is about the speculation about a lockdown during the mass testing. Chief Executive said that today that there won't be a wholesale lockdown. In other words, a limited lockdown. Can we just get more clarification on exactly what does that mean? Whether residents are still able to go out to buy daily necessities and medications and other emergencies that may come up. My other question is about what is the government doing to drive the vaccination of elderly? We're seeing that the majority of the deaths in Hong Kong from COVID is from under-vaccinated elderly people, many of them coming from care homes. HKU Professor Gabriel Leung said that the statistic is really worrying. There's under 20% of the elderly in care homes who are vaccinated, and he recommended that all of the residents as well as staff in these care homes are immediately vaccinated. What does the government think about that recommendation? And can you talk a bit more about existing initiatives in giving vaccinations to the elderly? Thank you.
Thank you for your question. For the compulsory universal testing, as the Chief Executive has given some details in this afternoon, and I have no supplement. In general, during the mass testing program, there must be some measures to keep the people at home, but the details and the exact timing of the mass testing is still under preparations, and the government will consult experts and as well as various sectors of the society to determine the best method. And for vaccinations among the elderly, it is very important for the elderly to get vaccinations because the vaccination coverage among elderly people in Hong Kong is on the low side, and this will pose risk to them in view of the current situation. And according to our statistics, the majority of deaths were among elderly persons, especially those aged 80 years or above, accounting for more than 2/3 of the death cases. And the case fertility rate among the elderly is much higher than the younger populations. And we also noticed that among the elderly persons, those who had received the 2 doses of vaccinations, their case fertility rate is much lower than those unvaccinated elderly. So the government is encouraging all elderly people to receive vaccinations as soon as possible, so as to boost up the immunity among these elderly people, especially those living in the residential institutions, because many of the elderly people living in residential care institutions, they have chronic disease and also other comorbidities, which will lead to much higher chances of getting complications or even death if they were infected by COVID. And the government has liaised with the social welfare departments to launch programs to increase the vaccination coverage among the residents and as well as staff inside in the residential care homes, including liaison with various non-governmental organizations and also visiting medical offices to provide vaccinations on site, as well as opening up the Department of Health has opened up our elderly health centers to provide free vaccinations to the elderly.
下一位，嗰邊尾二嗰行綠色上。
Next, the lady with the green top.
A few questions. According to the CHP website, close contacts under the Stay Home Safe scheme are still required to do 14 days quarantine. But now those who are fully vaccinated confirmed cases can leave after 7 days. So will the CHP update the Stay Home Safe requirements to match this? If not, why not? And are Stay Home Safe people still required to go to a CTC on day 12? My second question is earlier on a health expert has urged more private hospitals to help treat patients with mild symptoms. So previously the government also mentioned they are trying to do more to cooperate with public hospitals. So are there more detailed updates for this? Thank you.
For the quarantine arrangement for the household contacts of confirmed cases, previously they required quarantine for 14 days at home, counting from the day of specimen collection of the cases. And for a few days ago, we have launched a new policy that if confirmed cases, they have negative rapid antigen test on day 6 or day 7, and if they had received the 2 doses of vaccinations, then if the day 6 and day 7, both day 6 and day 7, rapid antigen test and tested negative, then they can resume normal life. And their household contacts, if they were also tested negative all along, including the rapid antigen test on day 6 and day 7, they can also be released earlier. And we will update the information on our website to inform the general public so that they know about their quarantine period. And also we have revised our quarantine order to add these conditions into our quarantine order.
I think regarding the private hospital, we have specific subject officer in our head office to work closely with the private hospital, aim to free up our capacity. We aim to transfer some convalescent cases, some stable convalescent cases to there, so that we can maximize our capacity to handle the COVID patients. For example, like the Tin Shui Wai Hospital before, the private hospital have taken up some of our cases so that we can speed up our pace to emptying the ward to handle the COVID situations. But I think there will be more room for doing that, and I hope that will be our liaison can be work closer.
下一位，呢邊尾二嗰行灰黑色衫嗰位女士。
The lady in dark grey. I'm from Ingpao. I'd like to ask the hospital authority. Today, Professor Yun Kok Yung said that some private hospitals have transferred patients with renal dialysis needs who have contracted COVID to public hospitals. Is it an ethical problem? How many such patients are there? Will it put additional pressure on public hospitals? Will you ask private hospitals to stop transferring such patients to the public sector? We see that for the Queen Elizabeth Hospital and Caritas Hospital have arranged for some containers to be put at their premises. Are they for storage of bodies? If not, are they for storage of medical waste with infectious hazard? My third question is to follow up on the 61-year-old male with renal problems. You said that he suffered from cramps and he passed out. When was he confirmed, and why wasn't he at the hospital? Has he been waiting at home till he died? I'd like to first answer about the renal dialysis service under the public-private partnership scheme. Well, private hospitals will accept patients with renal dialysis needs. These patients will be tested. For private hospitals, well, since there is a change of recovery criteria of COVID patients, we hope that these recovered patients will be able to receive the renal dialysis service in a private hospital. And there are about 60 patients who used to receive the renal dialysis service at public hospitals but were transferred back to us because they are COVID confirmed. In relation to transfer of bodies, we're working on different sectors to speed up the process. In relation to refrigerated containers, we have liaised with suppliers for the installation of refrigerated containers. We think that 500 cadavers can be stored at these facilities. But when it comes to storage condition, retrieval and transfer process, as well as infection control, we will exercise utmost caution, and we will respect the bodies. In relation to the 61-year-old male, we know that he had cramps and then he was sent to hospital. We don't know about any of the details. We don't have much information. We know that then the installation will take place in due course. The lady in middle. From Now TV, first, I'd like to ask the hospital authority. Some experts say that there will be a large number of confirmed cases under the universal testing scheme, so there will be a surge in demand for medication. Have you made preparations, say for example by increasing your procurement? What is your stock currently? Have you increased it by 6 to 7 times? Is that sufficient? I also like to ask about temporary hospital. You said that operation is in general smooth, and you also designate certain areas for people to have some breathing space. Well, what is the actual operation? Will it increase the risk of contraction by staff members and others? Previously, it's said that isolation facilities should be placed in at a sufficient level before universal testing. What is the progress? Will the increase insufficient compared to the change in our COVID situation? Have we reached a peak yet in the latest outbreak? Well, what is the progress of the platform for RAT reporting? Will it be launched this week?
For oral medication, we have sufficient medication for our patients. On procurement of drugs, we have been liaising very proactively with the pharmaceutical companies, and at the appropriate juncture, we will make these procurements. And we will also consider experts' advice on prescribing oral medication clinically for patients. On community isolation or treatment facilities, the hospital authority is responsible for the treatment part. The other parts are under the purview of the government. Now, take Asia World Expo's community treatment facility as an example. We do have a resting lounge for patients, and in the resting area, we provide sofas and TV for their enjoyment. About isolation facilities in different areas, the government is striving to identify more places to build these community facilities. Of course, the CIFs available at the moment will not be able to meet the rise in the number of cases. We do look forward to more CIFs being built so that we can take in more confirmed cases into these facilities for isolation to curb transmission in the community. At the moment, when the CIFs are still in shortage, we need to impose a kind of selection mechanism. We look at the home condition of the infected persons. If they lived in cramped living environment, they will have a greater need, and they'll be given priority to stay in a CIF. Another group accorded priority would be the recently infected cases. Because of the higher viral load they carry, they do pose a higher risk. Now, once we have sufficient isolation facilities, we will strive to send more infected patients into the centers. Have we reached a peak? Well, it is hard to estimate. It seems that the trend is still rising. It seems that we have yet to reach a peak, let alone coming down. As for the RAT platform, I believe it will be launched within this week. Next question, this gentleman. I'm from AM 730. I have a question for Dr. Au. Can you tell us the cumulative figure for the fifth wave? You talked about 120,000 cases. Am I mistaken? And about the RAT reporting platform, what is your estimation of the number of reports received when launched? And will the website be able to cope with the influx of cases and the subsequent tracing work, or will the platform be jammed like last time? And about the cases to be reported, are we talking about new infections or reports of older infections? Will you be able to make a daily announcement of the number of new cases? I'm sorry, perhaps I didn't make myself clear just now. As of now, since the start of the fifth wave, we have 281,099 cases. And that is the cumulative figure from the 31st of December. That is the start of the fifth wave until yesterday. And once the platform is launched, we envisage more cases coming in. Many citizens may be testing positive with RAT, and at the moment they are not receiving PCR tests. And these cases are not recorded in our current system. Once the platform is launched, as we expect, over the past week, many members of the public have tested positive by RAT and have stayed home. The first thing is, once the platform is launched for additional or new cases every day, we expect a hike in the numbers, but that only represents the reality, because previously some patients might not get tested because they couldn't secure a booking for PCR tests. Through this platform, we hope to get a better picture, real time, of the infection situation, and it will have a retrospective effect. But I think we should wait for the Food and Health Bureau's announcement on the cutoff date or the starting period. For the backlog cases, they will not be added to the system because they are older infection cases, not new ones. And by then we'll explain how the backlog of cases would be added to the overall statistics. Next, this lady in the light gray jacket. I'm from Commercial Radio. Some experts have recommended that after a compulsory universal testing to be launched this month, in the next month a smaller scale program should be launched, and another expert has advised that a CUT program should be launched after the holidays. Have you finalized on the dates of the tests, and what's the interval? What's the best interval? And another expert said that the test should not be carried out until the situation has subsided. Now, is there any idea to what extent should the epidemic situation subside, or how many isolation and treatment facilities should be available before the CUT is rolled out? Another question. After launching the CUT, it is expected that the number of infections would surge and that oral medication should be procured to get us prepared. And there are also proprietary Chinese medicine available. How should the Chinese medicine be distributed, and how should they be prescribed? And for the RAT platform, you said that it will be launched within this week. What if, before the platform is launched, my test result becomes negative? Will I still be required to make a report? And how would you handle situations under which members of the public avoid reporting their positive results because they couldn't get a medical certificate? And how do you tackle abuse of the platform? And also for cases originally testing positive and subsequently testing negative, how are you going to handle these cases? The first question on compulsory universal testing, the chief executive already explained matters relating to the CUT program, and I have nothing to supplement. Generally, around the world, in relation to large-scale universal testing, the only experience we have is one on the mainland. And I understand that there have been discussions among experts, and there are pros and cons in relation to whether the test should be conducted sooner or later. Our strategy is to achieve dynamic zero infection, so that we can implement early identification, isolation, and treatment. And I appeal to members of the public that if you know of anyone who has been infected, if you have visited a high-risk place, please get tested as soon as possible. You don't need to wait for the CUT. This is the spirit of early identification. And if members of the public are willing to get tested as soon as possible, positive cases can be identified earlier for better containment of the epidemic. I don't have information relating to the CUT. I understand the government will be heeding the advice of experts and considering the community's needs, the capacity of community isolation and treatment facilities before coming up with the best arrangements. About the online platform, like I explained, after it's been launched, for those who earlier tested positive, we encourage them to make a report anyway, and we would specify a date, and that if you receive a positive RAT result, you should register with us so that we know how many infected persons only have an RAT positive result and not a PCR positive result, so that we can have a more accurate picture of the epidemic situation. Now, it's all right if a patient gets an RAT positive result and a few days later gets a negative result. That means he's recovered. He can still indicate an RAT positive result, and the relevant documentation will be issued anyway, as long as, say, they reply to our SMS message stating the ID number and the picture of the RAT positive result. And then we will send by electronic means the quarantine order to him as well as to the family members concerned. And this will be counted starting from the date of the positive result. So if he only reports a case 7 days after he tests positive, and that by the time he tests negative and that he's been vaccinated, there is no need to be put under a quarantine order.
We're working with information and technology staff members. Well, if there is a surge in usage, there is a chance that the system might be affected. We will try to cater for a surge in use in our planning. In relation to the use of Chinese medicine, well, just like Western medicine, doctors will, based on the clinical condition, dispense Chinese medicine to patients. The reporter over here. I'm from Orange News. I have 2 questions. First, we see a steady number of cases in care homes. Professor Lau Yulong said that the interval between 2 doses can be shortened by 14 to 21 days. Well, we see a number of people doing their RATs in public places, say, for example, restaurants and shops. And yesterday, there was an appeal made to members of the public not to do that. Shouldn't the government issue clear guidelines asking members of the public to do the RAT at an appropriate location? Well, the risk of complications upon infection by COVID by elderly people is a lot higher. That's why we have been making an appeal to elderly people to get vaccinated. Different departments, including Department of Health and Social Welfare Department, in addition to Food and Health Bureau, have put in place initiatives to boost the vaccination rate among elderly people. In relation to the interval between 2 doses, well, we need to have a discussion on the scientific side. There is a joint scientific committee. They will look at the latest scientific evidence to see what is an appropriate interval between 2 doses. If need be, the committee will have another discussion and make a decision. In relation to the rapid antigen test, RAT, it should be done in a private place where there is good ventilation. It should not be done in a public place. On the CHP website, we have disseminated information in relation to doing RATs. We ask the public to read through them. I'm from cable TV. I'd like to ask the hospital authority, in general wards, have you installed additional extractor fans and to turn them into negative pressure beds? If so, what wards are they? And how many of these extractor fans have you installed? What is the specification in order to meet the requirements of a negative pressure ward? You just talk about community isolation facilities for people whose domestic setting is not appropriate for isolation at home. Well, how long do they have to wait before they can get in? Now, RAT test positive is considered a confirmed case. Do you have an estimate about the total number of people in Hong Kong who have been infected by COVID? Well, the epidemic situation is bad, so our beds, the utilization rate has saturated, so we have triggered the use of second-tier beds as well as other facilities. We have converted some general wards by installing high-power or heavy-duty extractor fans to turn them into negative pressure beds. On top of the extraction fans, we also have adjusted the air change frequency in the ward. These initiatives will be able to increase the number of isolation beds for our use. We hope that this will alleviate pressure we face. There are a lot of patients coming from care homes. They need a hospital bed. Our infection control team has conducted an assessment to make sure that these conversions will be done meeting all the requirements. Of course, we attach importance to the safety of our staff members as well. This is an extraordinarily time. These are extraordinary measures to boost our capacity to take in COVID patients. I don't have the number, but they are general wards. Well, previously, for AIR tiers 1 and 2 beds for negative pressure wards, the usage has saturated. In relation to community isolation facilities, well, it's not sufficient for everyone, so there is a priority. Our current strategy is to arrange for newly diagnosed patients to be admitted. There is a lag in different areas in terms of reporting and arrangements. So we don't follow these time sequence of reports made. For those who have previously reported their cases to us, they would be on the way of recovery. So if we have additional vacancies, they will be given to patients who have just been confirmed, say yesterday or the day before. These are patients with a higher risk because they are recently confirmed. I don't have the waiting time. In general, you have to wait for 2 to 3 days before you are transferred to isolation from quarantine. Well, if you are tested positive, please make use of our platform to furnish your information to us so that we can expedite the process of arrangement to get the patient to an isolation facility. We will take into account high-risk factors, say, for example, whether there are people with a weak immune system in the household. We're aware that there are people who have received messages with a prefix +852, supposedly from us. Well, these are most likely fraudulent messages. The CHP will use messages sent out with the prefix +852, but we will only send these messages to those who have already done a PCR test. We'll ask them to furnish information to us. But if you've received an SMS and if you are suspicious of the origin, then you can use www.chp.gov.hk/cdpi. Type this address in your browser before you enter any information. into the system.
Next question from Phoenix TV. According to the expert, according to Dr. Au, after rolling out the platform, the CHP will have the better picture of the epidemic situation in the community. However, according to reports, you can use use orange juice or other beverages to make the RAT result positive. How do you screen out the abuse cases to make sure only genuine RAT positive results will be reported to the via the platform? Thank you for your question. About the rapid antigen test, the epidemic situation in Hong Kong at the moment is very serious. So the chances of having false positives would be very low in terms of RATs. We understand that for RATs, the sensitivity is not as high as PCR. It nevertheless is able to detect patients with higher viral loads. Now, in relation to the RATs available in the market, our public laboratory service has conducted tests in relation to the Omicron variant. We find that these cases can be detected. In fact, recently we've conducted tests on 13 brands, including 10 specimens on 13 brands, and they're all effective in detecting the virus. So we encourage members of the public to get tested if there is suspicion of infection. At this stage, we're unable to substantially increase the capacity for PCR tests. So RAT is one way of boosting our testing capacity. We believe the majority of patients testing positive with RAT are genuinely positive cases. And I would appeal to these citizens to report the cases to us via the online platform. I believe the Hong Kong citizens will make good use of the platform, and we will also verify their identity. Once the platform has been launched, we will keep in view the situation, and we may conduct random checks on members of the public testing RAT positive, in a sense that they'll be arranged to undergo PCR tests to verify the positive result. Arrangements will be made once the platform has been launched. Next question. I'm from Tai Kung Pao. May I know the work of the contact tracing office of the government at this stage? Today you recorded 55,000 confirmed cases. How will the contact tracing office trace the close contact of these 55,000 cases? The function of the contact tracing office is to trace the cases and trace their close contacts and household contacts. As usual, we proceed to this line of work as soon as possible. We do have a great amount of cases, and the contact tracing office at the moment focuses on issuing quarantine orders on household contacts identified. They would get information of infected patients and their family members via the online platform for the purpose of issuing quarantine orders. For cases which have not been reported to us via the platform, the contact tracing office will trace them down and ask them for information so that the quarantine order can be issued against the household members. Of course, we do have a backlog, and we have appealed to colleagues in the contact tracing office to first get the residential address of the confirmed case by ringing them, and then in the same day And we make sure information will be passed to them by different government departments so that the government departments can then send out kits, anti-epidemic kits to these households. Home quarantine orders will be issued later on, informing them of the quarantine period. Next question, this lady in yellow.
Free Press. I'd like to ask, what's the finalized tally for COVID-19 deaths after the revision today at public hospitals? And what is the total number of deaths that the government has recorded in and outside of the public hospitals, given that there has been conflicting tallies given by CHP and HA? And is it correct that the government currently has no public and finalized tally on COVID-19 deaths occurring across the board? Second question, Hong Kong Free Press has gotten in touch with several dozens COVID patients who chose to self-isolate at home because they have no reply from government hotlines or distrust the system and therefore never reported it. Will they face any legal consequences, and what's your advice to them? Third question, will makeshift hospitals, including the ones in Chengyi, be used only on healthy patients with no or mild symptoms, or will they include more severe patients requiring medical care? Will HA doctors be deployed there and draw away manpower from public hospitals that are already overstretched? And four, the wives, domestic workers, and drivers of 6 chiefs of bureaus and 2 undersecretaries have contracted COVID-19, and yet the officials themselves have not become infected. Is it unusual that the disease is not affecting people in the same household? Thank you.
I think I answered the community isolation facility first. Actually, we receive stable and rather young and fit patients right there for isolations. And you talk about for rather ill patients. I think for ill patients that need to be cared in the hospital, but we have the community treatment facility that we can look after cases which is in between. They're rather stable, but they will be older or with some medical background, and we can give some give some treatment there to a certain degree. The medical post will be run by HA, and we have to deploy doctor right there. But at the moment, we actively to explore any other alternative. Especially, we can recruit some locum doctors who is from the private sector to help.
Next question.
Do you have any supplement?
For the last question, you mean the household contact, the chance whether why they have not contracted COVID-19? Okay. For household contact, I think they have the highest risk because they have the degree of contact with the cases. They are living together, and they share toilets and also share inside the same household environment. So most of according to our experience, the household contact, they have a very high chance of getting infected. But however, for individual cases, it depends on a lot of factors, such as the infectiousness of the cases, whether the cases and the household contact have received any vaccination and the number of doses, and also whether they have observed the preventive measures such as wearing masks, ventilation of the household, size of the household, so etc. Yeah, and so it depends on a lot of factors.
Next question.
The lady in white.
We count the patients who pass away in the public hospital, and for the 5th wave now the total is 967. And the pandemic will be 1,172.
Some questions from RTHK. So as we know that the government have already imposed very strict social distancing measures in Hong Kong, but the CHP even reports over 50,000 cases today. So is there a reason why there is an increase of the cases but not a slowdown despite the strict measures. Does this mean that the measures are inadequate in controlling the pandemic? And what more can be done to tackle the situation? And also, do you have an estimation on how many people will report positive test results when the online platform is launched later? Thank you.
For the first question, the government has implemented a series of social distancing measures gradually over the past 2 months, and I think this is effective and also can slow down the epidemic because people are having less activities in the community. But however, what we observed is that the number of cases is still increasing, indicating that there are still many transmission chains in the community, and we foresee that the trend will be rising. It is very difficult to assess whether the social distancing measures are not adequate, because if without this social distancing measure, the number of cases might have very explosive or exponential increase. So what we observed that right now is that there is a doubling of the number of cases every 2 to 3 days, and so it is very important for people to get tested so that they know they are infected and have isolating themselves at home to prevent further transmissions in the community. For the online platform, we foresee that there will be a lot of cases, maybe up to thousands of cases reported every day, because rapid antigen test is commonly used in the community. And according to our online platform, currently used for reporting of personal information by cases tested positive for RT-PCR, we noticed that there's quite a number of cases. Quite a number of citizens, they report their information through this online platform, indicating that they were tested positive for rapid antigen tests up to several thousands. So we foreseen that after the launch of this platform for people to report their rapid antigen test, there will be quite a number of cases reported from this platform.
下一位，我哋答埋最後呢位啦，呢位女士。
你好啊，經濟部㗎。首先想追。
I'm from Economic Times. I'd like to ask about the death cases. A 58-year-old mental patient. When was she admitted? When was she tested positive? Was it an infection in the hospital? Was she in an infectious disease ward? How many other people have been affected? Well, what's the liability or responsibility of the hospital in relation to the RAT reporting platform? Does one have to take a picture of the test kit for uploading? Will you still send them the isolation certificate to them? You mentioned about refrigerator container with a capacity of 500. When will it be put to use? Would there be any lag? Are there still bodies waiting to be transferred in relation to private hospitals? Altogether, how many beds in private hospitals are there for COVID patients, and how many patients have been transferred from public hospitals? In relation to oral medication, are there any new ones? Do they include new drugs from MSD and Pfizer? Let me first talk about the 58-year-old patient. I mentioned that she has been staying at the Kowloon Hospital for a long time. She was admitted in November last year. The confirmation was done in February. In the end, she was transferred to Queen Elizabeth Hospital. She passed away on the 1st of March. Regarding private hospitals, there are about 100 beds for our use. I will give you the actual number in writing later about the actual utilization rate. The use of new medication, we'll have to talk to different experts, and we also have to work on clinical guidelines. I do believe that is the case. In relation to the online platform, we would ask patients to take a picture of the RAT kit, and they also have to upload supporting documents, say for example their ID document. They have to give us their personal information and the date when the specimen was taken. It's very important because that will affect the expiry date of the isolation or quarantine order. You'll be asked by the platform whether there are special circumstances when isolation facilities or quarantine facilities will have to be arranged. If need be, the person will be sent to an isolation facility. So the information is very important. That's the end of the press conference. Thank you. Well, the refrigerated containers are arriving. I think there are different schedules for different hospitals. Sorry, speakers off mic. We don't have those figures. We believe that public hospitals will deal with COVID patients, so that will be the figure. Sorry, speakers off mic. The reporter is not using a microphone. The interpreter cannot hear the question. The interpreter cannot hear. We don't have that figure. May I supplement? In this outbreak, well, all the cases were done via the hospital authority. In the last outbreak, there were patients who passed away outside the public sector, but I don't have the figure. I'm talking about the previous outbreak. We'll give you the information afterwards. Sorry, speakers off mic. The speaker is not using a microphone. Sorry. Speaker is not using a microphone. We'll give you an answer in writing.